Our presentation is on the adult bedside swallow examinations, and we decided to create a caregiver's guide to a bedside swallow examination. So it's important to define a few key concepts before we proceed with explaining what a bedside swallow examination involves. So dysphagia is a symptom that refers to pain, difficulty, or discomfort during the progression of the bolus from the mouth to the stomach. An aspiration occurs when food or liquid enters into the airway below the levels of the true vocal fold. A fiber optic endoscopic evaluation of swallowing is used to identify normal and abnormal structures and functions of the pharynx and the larynx. During the FEES exam, a speech pathologist passes a thin, flexible scope through your nose. Then the SLP views parts of your throat before and after the swallow. A video fluoroscopic swallowing study is used to identify normal and abnormal structures and functions. This procedure provides a direct dynamic view of oral, pharyngeal, and upper esophageal function during swallowing. During this procedure, the SLP presents food and liquid mixed with barium. Barium is needed to view structures via video fluoroscopy during the swallow.
So first you'll want to know what a bedside swallow exam is. So it is a non-instrumental and minimally invasive assessment that provides the clinician with enough information to diagnose oral dysphagia. Aspiration and other physiological problems are only seen through an instrumental exam, but a bedside swallow evaluation can provide better insight whether if the patient needs more testing or not. The purpose of a bedside swallow evaluation is to assess a patient's swallowing function and to evaluate any signs or symptoms of dysphagia or aspiration. The clinician will take into consideration any extraneous factors such as fatigue, position, posture, the consistency of a substance, and environmental factors when eating and drinking. So now the question is, who needs a bedside swallow evaluation? So it is critical if a patient is suspected to have a swallowing disorder or dysphagia. If a person goes to swallow and there's food or liquid left in your mouth or collected on any structures, it could potentially enter the airway, which would then cause aspiration. If food or liquid continuously travels below the airway, it can lead to other health issues such as pneumonia. Some other conditions that might put some more people at risk for aspiration and dysphagia may include experiencing a stroke, having dental issues, decreased saliva production, mouth sores, Parkinson's disease or other neurological disorders, muscular dystrophy, or blockages in the esophagus, which can be from cancer. Additionally, if a patient is experiencing food getting stuck in the throat, difficulty or pain when swallowing, or trouble breathing, they may also be seen for a bedside swallow evaluation.
So are there any risks associated with the bedside swallow examination? Overall, the bedside swallow examination is safe. There may be a slight risk of aspiration, but the SLP will try to prevent this from happening. The SLP begins the examination with either dry swallow or substances that will be easiest for the client to swallow. If the client is displaying signs of dysphagia and aspiration or difficulty with specific substances, the SLP will be sure to eliminate the presentation of those consistencies.
So if you are having a BSC, how should you prepare? So you may want to make a list in the weeks leading up of any swallowing discomforts, problems, or specific consistencies that you notice you have difficulty with. And this will ensure that you just remember these things to tell your SLP when you are in their office for the examination. And additionally, the SLP may advise the client to refrain from eating or drinking certain foods ahead of the examination. And besides these two factors, there is really nothing a client can do to prepare other than that.
Okay, so what should I expect to happen during the bedside swallow examination? So the SLP is first going to ask the patient questions about the nature and the severity of their swallowing problems, and then they're also going to assess the level of the alertness of the patient. They will then evaluate and observe the teeth, facial muscles, cranial nerves, velum, vocal quality, lips, jaw, and tongue. The patient may also be asked to cough or clear their throat, which is going to assess the voluntary cough. The SLP may also check for the gag reflex. After that is done, the patient will be presented with different consistencies, such as different waters and different foods. The SLP will evaluate if the patient presents any problems with chewing, swallowing, or breathing, and if the vocal quality sounds wet.
So first, the healthcare professional will ask a case history and ask questions such as, what is your chief complaint? What is your current diet? And how long does it take you to eat a meal? The SLP will also observe the patient's status, level of alertness, if they are oriented to the situation, and their ability to manage secretions. Then the SLP will complete an oral motor examination that will assess the cranial nerves that are responsible for the function of the swallow. And the SLP will finish by administering trial swallows. The SLP will begin by telling the client to complete a dry swallow. Then he or she will administer a variety of consistencies to the client. It's important to note that the clinician will assess the swallow after each bolus administration.
So what happens after the bedside swallow examination? Many individuals that do have this examination are asked to stay at the hospital because they're going to be needing treatment for their other medical problems, as discussed previously. The patient is likely to go home after the exam if it is conducted during a visit with a healthcare provider. The patient is typically given their results immediately following the exam, and if the results indicate that there wasn't a swallowing difficulty, then the patient's able to remain on the diet they had previously. If the patient indicates that they may have a swallowing disorder or difficulty in consuming different consistencies of foods or liquid, they will need to be referred for an instrumental examination. So depending on the swallowing difficulties and depending on the conditions of the client, the SLP will decide if the patient is eligible for a video fluoroscopic swallow study or for a FEES examination to further evaluate their swallow. And that will conclude what we found for explaining to caregivers about a bedside swallow examination.